Hearing from you, listening to you is what this night is all about. So before we get started into the questions, as opposed to going on and providing biographies for our featured speakers tonight, I'm going to turn it over to them and let them tell their stories of who they are as public servants, as leaders, and just for you to get to know them a little bit better as we go through the evening tonight. So I'm going to turn it over first to our city manager, Dee Williams-Ridley.
Thank you, Dave, and thank you everyone for joining the calls. It looks like we have a huge participation this evening, and I'm so grateful to have this opportunity to talk with all of you. First, let me start by just sharing who I am. I think some of our community, they've met me before, and others may have not. Just a little bit about me from a personal basis. I'm your city manager, but I was born and raised in the 1960s in Birmingham, Alabama. I'm a child that's youngest of 6. I grew up in a very, very wonderful environment. It wasn't a wealthy environment. In fact, it was a very poor environment, one in which I was challenged daily about who I am, about what we are as human beings and how we treat one another. But I will tell you that growing up in poor and unwealthy environment, I was loved. I was surrounded by a matriarch, a mother, a grandmother, a great-grandmother, and a great-great-grandmother. They instilled a tremendous amount of courage in me. They taught me how to be kind, how to care about others, how to not forget who I am and where I come from, to make sure that I always check my voice, be authentic, and be sincere in what I do. My career spans 30 years of public service. I've worked in Sacramento, Modesto, also in the Bay Area, San Mateo. I've worked in New York City. I've worked across the world, and all of that service, all of that work has been in public service. I am a true public servant. I believe in people. I believe in being authentic, and I believe in making sure that I collaborate with others. I know people often look and they wonder, as a city manager, how are you facing racism? How is that even something that you are even a part of? I tell you, it exists everywhere. It exists even in the boardrooms. It exists in the locker rooms. It exists at the table that I sit. It exists in cubicles. It's everywhere. I'm often challenged with being aggressive or being assertive. But I'm here to tell you today that I am both aggressive and assertive. I will be aggressive and unapologetic about who I am, what I stand for, and my plight to make sure and to ensure that racial justice is brought to the light for everyone. The last week, 2 weeks of events for our community and our nation have been hard. They have been tough. It has been painful, not only for every single citizen in our community, around the world, but also in our households, in my household, in your household. And I will continue to be assertive as a leader. I'm nationally recognized across the nation for my leadership on race and equity. And I will continue to push the agenda for all people in all races. And I believe very strongly that as a leader in this community, it is up to me to make sure that my voice is heard, that you all get to know me, that you know what I'm about, what I value, why I care about public service, and to know that I'm here to serve. And my challenge to my employees, to the entire workforce of the city, is that we serve with courage and that we serve in being kind. That is clearly something that I push hard every day, because it was instilled in me as a child growing up in the Deep South, in just an environment where I would tell you the racism was both covert and overt, and people got to experience it every day. I wake up as a Black woman, understanding and knowing that I have faced racism every day, and to this day, it continues to be something that I'm challenged with. But I am committed and eager to help be a part of the solution and to make sure that our community know that they have a leader that's here that wants to see change. And with that, I want to turn it over to, back over to Dave White, our moderator. And my last comments is this: to be excluded or to be isolated is the very basis the very basis of racism. And for me as a leader, I want to make sure that my voice is heard and that my ears are open to all of you. So that is why I've asked for this community forum this evening, this town hall, so that I can hear from all of you, so that I can answer your questions, and so that you get to connect with me and you get to connect with our chief of police and also with our health officer. We are all dedicated public servants and we are here to serve. Thank you, Dave. Please take over.
Thank you, Dee. Chief, I'd like to turn it over to you. You're on mute, sir.
Great start, right? Thank you, Dave. I'm Andy Greenwood, as you know, the Chief of Police here at the Berkeley Police Department. A little about me, I was born in Alta Bates Hospital in 1962 and have lived in Berkeley nearly my entire life. I went in kindergarten there at Jefferson, then to Franklin, where in 5th and 6th grade, I was a Berkeley Junior Traffic Police Crossing Guard, which I took hugely seriously. I went to King and Berkeley High and graduated in 1980. I have a degree from San Francisco State in interdisciplinary social studies. And I had the privilege of spending a year abroad and living in Sweden for a year as part of my college experience. My parents still live in Berkeley in the house I grew up in, near Cedar McGee. My sister and her family live in town. Excuse me. My wife is Sanse, a 3rd generation Japanese American. Her family comes from the Central Coast where they're farmers. Her grandfather, Juzo, came from Japan with his brother to settle in King City as migrant farm laborers. Their families ultimately settled further down on the Central Coast, and now the 4th generation of that family are still working in the family farms in that area. Their community was rocked in World War II by having to be interned in camps. Many of the Japanese American families that worked in that area left after World War II. My wife's family was fortunate enough to land back in the town where they're from with people they had grown up with who supported them as they stood their farms back up and were able to go back into their business. I started here as a trainee in January of 1986 and became an officer in January of 1987. This is the only place that I ever wanted to work. I consider myself fortunate to serve here for 34 years, including the last 3.5 years as chief, and to be serving with an amazing group of dedicated professionals, of police officers, of dispatchers, of parking enforcement officers, and community service officers, and our outstanding professional staff who are all here to serve. And that's sort of my context. Thank you, Dave.
Thank you, Chief. Dr. Hernandez?
I've unmuted, so one thing right so far. Good evening. I want to thank Madam City Manager for inviting us here today. I think this is a critical conversation for us to have. And I'm happy to be part of this group and honored actually to be part of this group. I'm Lisa Hernandez. I'm actually a New Yorker and was born in Valley Stream, New York, which is in Long Island in the late 1960s. I have a twin sister and that's just the two of us in the family. My mom and dad were raised in Harlem and met and then moved us to Long Island for a better life. My dad is a public servant. He retired just 1.5 years ago. And my mother most recently worked as an administrator in the local college in Miami. I have been in public health for about 14, 15 years and have worked in California public health from Monterey County all the way up. I've been working my way up from the South. I know King City very well, Chief Greenwood. served the community there, and have been working in public health since then, where I trained in public health. I am a city health officer now, and that's a change for me because I worked on the county level. And the unique thing about working as a city health officer is that I get to work, closely with all city departments, learning the city departments in a way that I never learned the work in the county level, and interacting not only with my colleagues in different departments, but also with the community in a deeper way. And I think that's really important for a public health officer to do, to have that relationship with those that we serve. As you can tell, I'm African American and Puerto Rican, Latina, and that cultural background has shaped my training, how I approach the work I do, how I approach the communities I serve, the people I work with. I think it's really key to be very humble and to understand and remember where I came from, and also where different people are coming from, because we're all different, not only in how we look, but how we experience life. I also have experienced racism, as the manager has mentioned. It's something that we deal with daily. And that's part of how I approach my work. And I'll end there and just turn it back over to you, Dave, and we'll dive into the questions.
Thank you very much for that. And I've received numerous questions throughout the course of the past 24 hours, and we're starting to receive some now through the question and answer. And so this is really how we're going to run the rest of the time now, is we're just going to go through questions that we've received, and we're going to allow our city manager, police chief, and health officer respond throughout the evening. So I'm going to start off with some initial questions. Chief Greenwood, the death of George Floyd has provoked deep pain and outrage across the nation and even the world. Could you tell us how you see that incident, and how does it inform your role as the chief of police in Berkeley? Chief, you're on mute again.
Thank you. I'm stunned and profoundly disheartened to see the murder of George Floyd at the hands of those with whom I share a profession. These acts run so contrary to the spirit of service under which I and our people serve. It's devastating to see these acts happen. It's devastating to experience the full turning of society on law enforcement out of understandable and justifiable anger, but it is something to absorb that. So my role, and the role of our leadership team, is to navigate our department through these remarkable times and to build on a progressive tradition of policing that we hold close here at the police department. And our challenge is to navigate a course to greater connection and connectivity with our African American community, and to do so in this very highly charged reactive chamber that I think we all find ourselves in. The wrongs of society's historic and systemic racism, and the burdens of the lived experience of African American, like our fellow African American, our fellow citizens who are African American, the burden that they hold that I think largely have been unseen and maybe now are coming into view, weigh heavily upon me, and I think any of us who are experiencing an even greater sense of their lived experience. We have a diverse department here, and our people are suffering from the same extraordinary pressures that we all are in our community, from COVID and managing our families and our personal lives in the midst of a pandemic, to doing the work here in the face of societal rage that seems to be just building and building. We have, I think, an amazing record of professionalism, of not relying on violence, and force to accomplish our mission. I am very sensitive about going on about what I feel like are the accomplishments, because I don't think it matters in some sense. It does matter to me and to us here at the department, and I think to many of our community members, but it does not start to address or redress the wrongs that have been happening for so long. And I think the lack of sensitivity and empathy to the experience of those with whom we work and live. We have worked over time to provide the tools to police in a progressive manner, not only adhering to the constitutional law and organizational values that call upon us to treat people with dignity and respect, to watch out for safety, to embrace diversity. Those are the values we work by. We use force in a tiny fraction of our arrests, and we operate in an environment that is really challenging because we are called upon to respond to people who are in crisis, not committing crimes necessarily, although sometimes that's an issue, but it's people who are facing these tremendous struggles in a horrible kind of Venn diagram, some living on the street. So the diagram of poverty, of racism, of alcohol and drug abuse and addiction, and of mental illness fueled by meth on our streets. So the police end up being the first ones called to go and respond to calls for service or calls for help for people in our community who are suffering from these things that really the police hopefully didn't play a role in putting them in. And the opportunity now for us is to re-examine how we're deploying ourselves, to really step back and take a greater look at how we can be deploying ourselves to meet these needs and to work with other departments. And internally, I think it's an opportunity to develop more empathy, to continue to focus on treating people with dignity and respect, to encourage deeper understanding and connection with our community in service to them. And part of that is like setting aside blame and shame, actively and mindfully setting that aside, trying to reduce a reactive response of defensiveness when we may hear something that we disagree with. But the challenge is to keep our minds open, and our hearts open to what's going on with the community. In the 80s, when I started, connectivity with the community, when I started riding along in 1980, 81, becoming interested riding with people like Bob Rodriguez, a Latino man who came from West Berkeley, and Woody McWhirter, an African-American officer. When I started riding along, and then when I got hired in 1986 and I rode along all the time, I was super highly energized to be out and about. I experienced connectivity with community as something I saw with African-American officers who worked here when I was a young officer, who by then were maybe midway through their career. And these were men and women who were born and raised in Berkeley and in North Oakland, who had an intrinsic connection with people. So as we drove by, they would call out their names. I mean, working with them was an experience of hearing people call out by their first name or their last name, people calling, "Hey, Blackwell, Felton, what's going on?" I mean, these are men that we work with, many of whom have passed too early, I think. And now I think it also as victims of systemic disparities in race, men who've died 10, 15 years before probably their white counterparts would. Chief Dash Butler. Charles Blackwell. Felton Frost. So I saw connectivity that comes from coming from the community. And that was a fortunate, kind of wonderful thing to have experienced. And then as they have retired and times have changed, we had a period of connection in the 90s with the advent of community-involved policing. And that increased connections, but over time we've lost those connections for a variety of reasons. I think we've lost that emphasis on connection. And although I think for some of us there is legitimate value, legitimate human connection with people in our neighborhoods where we've known each other, that comes in part from years and years of service. So now we have a police department with newer officers, some of which, or most of which, don't come from here, and in fact haven't for a while, although some do. And the challenge is to mindfully build connection and empathy and understanding with our community, our African American community, our Latinx community, our LGBTQ community, to navigate our way to how we can rebuild those connections, and how we can be sensitive to their input to collaborate on the best way forward to policing, or to doing the police service in our community. So my focus right now is on preserving the space, which feels like it's incredibly rapidly being taken away from us. But I feel like we have an obligation to preserve the space here in the community for the police department to make well-reasoned, strategic decisions about how we deploy our people, about how we can be connected with our community to better meet the demands of transparency, to share information and data and life experience and our truths, and create opportunities to connect. And I think that is the direction we have to go. And I don't know what the specific destination looks like, but that's the direction on the horizon that I think we have to go. And that's how I regard my role as Chief of Police right now. Thank you.
Thank you, Chief. Dr. Hernandez, as health officer for the city of Berkeley, you have spent time specifically looking at health inequities in Berkeley. It is at the core of public health. Can you tell us more about what you saw in Berkeley in terms of race and health, and how that has played out before the pandemic?
Sure, I was just holding the health status report, which is almost 2 years old today, actually, which is a report that is released periodically from the public health division and the health officer that looks at the data of our community. And since it was first released now over 20 years ago, we've looked at the health conditions of our community from a lens of health equity and race. And overall, when you look at the city in the big as a whole community, our health looks good. But when you focus in on certain communities, you see that not everyone has that same opportunity to enjoy good health as others may. And what we see, especially in certain communities, such as the African American community and the Latinx community, is that we're dying earlier, and we're also suffering from other conditions, such as chronic diseases, such as hypertension, high blood pressure, diabetes. And we see that in a number of other indicators in our health outcomes. And some of the notable ones include some that you don't necessarily consider as health, but they absolutely impact health, one of which is income. African American families have a lower income than any other racial and ethnic group in the community. And in fact, for every dollar that a white family makes or earns, African American families earn 28 cents. When we look at high school students in the city of Berkeley, African American high school students are 1.4 times more likely than white students to drop out of high school. And approximately 1 in 10 of Latinx students drop out as well. They do not graduate. African Americans are 35 times more likely than whites to be hospitalized for high blood pressure. These are striking indicators that we see. And then we also see that African Americans are more likely to die in a given year than their white counterparts. So these are issues that we normally look at in racial groups, but actually these issues all stem from historic injustices that, that the communities have faced over the years. Even way back in the early 1900s from redlining, and where we saw that the community was divided based on racial lines, and segregation was continued and reinforced through property values of communities. We see that, and if we fast forward to today, in terms of the health impacts in our neighborhoods. So we look at things by race, but it's actually racism that has continued to impact our communities. So that's what I look at when we're looking at any health issue. We work to have programs to address those issues, and we continue to do that. And of course, the more that we can do more, but that's how we look at the work that we do, and then we release this health status report periodically to serve as a benchmark in terms of how we're doing, and if we should redirect our work based on the outcomes that we've discovered.
Thank you, Dr. Hernandez. I appreciate that. City Manager, I'd like to turn it over to you. As an African-American woman in the city of Berkeley, how does what happens in the world manifest with you?
I think, you know, there are lots of things to relate to, and I'd like to pick just an area of topic and rely on some facts to kind of express that topic. In terms of how it manifests, the systemic racism that exists for people of color, especially Black men, and for me as a mother raising 3 young African-American males, it questions to me what their future looks like. So when I think about that, I have to look at stats and statistics. So I want to share some with you because I think it's really important. And I know we're sharing a lot of numbers, but these are real numbers that affect people right here in Berkeley, that affect them all over the world. So while people of color make up about 30% of the United States population, they account for 60% of those people imprisoned. According to the Bureau of Justice statistics, 1 in 3 Black men can expect to go to prison in their lifetime. Students of color, right here in our city, students of color face harsher punishments in school than their white peers, leading to a higher number of youth of color incarcerated. Black and Hispanic students represent more than 70% of those involved in school-related arrests or referrals to law enforcement. Currently, African Americans make up 2/5 and Hispanics make up 1/5 of confined youth today. According to recent data by the Department of Education, African American students are arrested far more than their white classmates. The data showed that 96,000 students were arrested and 242,000 were referred to law enforcement. These are stats that show that 70% of those arrested or referred students were Hispanic and Black. African American youth, they have higher rates of juvenile incarceration and are more likely to be sentenced to adult prisons. As the number of women that are incarcerated, that's increased by 800% over the last 3 decades. So women of color have been disproportionately represented, while the number of women incarcerated is relatively low, and the racial and ethnic disparities are startling. African American women are 3 times more likely than white women to be incarcerated. So when you think about the systemic racism that's happening across the world, you can look at certain specific sectors: incarceration, poverty, housing, affordable housing. You can look across the gamut. You can look in the boardroom. You can look in the restaurant, in the grocery store. We are proportionately, disparately treated in every sector of humankind. So I've chosen the incarceration facts to share with you But we could list facts in every other opportunity there is, from health disparities to incarceration, to getting a high school diploma, to going to college. The racism, the systemic racism that exists in America and right here in Berkeley, it has to be stopped. We have to find a way and to have courage to take action that makes sure that this changes. As an African American, as a Black woman, I'm frustrated. I'm discouraged, and I'm tired. Those are my comments. Thank you.
Thank you, Dee. I appreciate that. I want to turn to a number of comments and questions that are coming in live and have also come to us over email. And so over the past week, a few days, there have been a lot of questions and comments and requests to defund the police. Some of the comments that we're seeing are, at the town hall tonight, I would like to hear the city's thoughts on how some, perhaps a large portion of our police budget might be better directed at non-police response programs that could better address a significant portion of the calls that the police get, like mental illness and homelessness, as well as more fundamental programs that address poverty and crime in our city, such as Boys and Girls Clubs, youth sports programs, domestic violence programs, etc. I hope the city is thinking about how we could effectively defund the police, even if our police department is a relatively commendable one. Another comment on this topic. Assuming a shift in funding and personnel, what responsibilities does the police department currently hold that will be transferred to currently existing departments such as fire and health and human services? What responsibilities should be moved out of the police department that would require the creation of a new department? So this is not a new concept. In fact, I would say I attended a forum hosted by KPFA a few years ago on the police abolition movement and efforts to defund the police. This can mean many things to different people. I would like to turn it over to you, City Manager. Where does this work begin? How does this conversation advance in Berkeley? People are eager to hear.
This is an incredibly important conversation to have. How I think it begins in an inclusive environment where we bring people of color to the table, we bring law enforcement to the table, we bring faith-based organizations to the table, and we talk about that change. I think it is time for us to step back and start talking about how should our police department look as our community looks. We need to start thinking about how do we have them focus on what's essential and important to reduce crime and to prevent crime in our city and to address crime when it arises in our city, and have the focus for mental health and drug abuse and those types of services participated and dealt with by other individuals within our organization. It's important for us to separate those pieces, but allow the need for those pieces to be influenced by one another. Because at some point, we have got to make a difference in terms of how we deal with our homeless, how we deal with our people of color that are on the street, our veterans, our women. There are young women in Berkeley that are on our street that I've talked to every day, asking them, how are you doing? How can we help you? And they are so discouraged. They are so discouraged until it is hard to even reach them. We have got to find a way to reach them. This is hard conversations, but we can't do it in isolation, and we cannot do it without people, without Blacks and whites and Hispanics and Asians and people at the table with us. We have got to have a conversation that starts clearly with urgency, but certainly with thought. We can't just go and ram it through and make it happen. We have to be thoughtful. We have to be courageous, and we have to be ready to talk about how do we fund a new and a more reflective police department in terms of what we need to address crime, and how do we fund and have a reflective public health and mental health organization. We're the only city in the state of California that has both a mental health and public health agency. That in and of itself demands that we support it, we fund it, and we make sure that it can meet the needs of the community. If not, we need the county to come in and do the work for us. And I don't want that. I want us to localize and make sure that we can meet the needs of our community. But that is going to take thought, it's going to take a process, and it's going to take courage for all of us as leaders. And as you heard the chief say, to not be defensive about our policing efforts, to not be defensive and controlling of what our public health and mental health services are. And for all of us to think about, how do we allow our employees to go out and do their jobs, and to help them through the fear that they also experience going out there if it's without support or law enforcement. We've got to find a way to make sure that they feel safe and that our community feels safe. Thank you.
Thank you for that. I want to turn to another question to you, Chief. This has to do with experiences of racism, has to do with experiences of sexism. So I want to read some of the questions that have come in. I appreciate that Berkeley is trying to reduce the negative impact of policing, but I believe racial profiling remains. An elderly Black male colleague is routinely stopped when driving for no obvious reason in Berkeley, while I, a white female, am not. I've also called the police in the middle of the night about someone on my property and had the first question be, what race are they? How could I tell? It's 2 a.m. Making people uncomfortable in our community prevents them from enjoying and employing our many opportunities. I also see in the question and answers, what is a useful way for the police culture to deal with racism and sexism? Should funding go to providing meaningful training and continuing mental health support addressing these issues? So Chief, I'd like to turn it to you to talk about what are efforts you're doing to reduce racial profiling and ostracism and dealing with racism and sexism in the department. Please take it off mute, Chief.
Thank you. So to start, the first comments that you read, an account of an elder African-American man being stopped repeatedly. So that is the kind of problem or issue that I think gets solved with connection with the community, where there's trust, where there's connectivity, where people can reach out to us about that sort of thing, or about that incident, or about that man himself, to find out what's going on. It is a frustrating truth that anecdotes like that, we often don't have the opportunity to address. So I think that we benefit in that kind of question from greater connectivity, engagement. As for the dispatcher going right to the race of somebody who's being called in on, our job is to gather as much information as we can when we're being called upon to respond to something, and that includes a person's description. So that's part of the reality of wanting to gather accurate information upon which our officers can act, and asking the race of a person is a piece of that in terms of description. So that is an important piece of what our dispatchers should be asking and the information that should be passed along. I understand with a sensitivity about race how it may feel that that's a question asked or the first question asked. It's also basically in the order that we say things here. It's race, sex, age. It's the top of that sort of list of the way we process that. Dave, can you restate the second part of the comment? Or the second chunk that you said? You're on mute now.
The second one had to do with racism and sexism, and what is a useful way for police culture to deal with racism and sexism?
So I think attending to those issues where we see them through training. I think there's holding the values as we do of diversity and of progressive policing set us in position to be sensitive to those issues and to operate with those issues in mind within the organization. And I feel like that's an unsatisfactory answer, there's not a magic training that suddenly eliminates racism as an issue or sexism as an issue. I think the value, I actually think the biggest value in dealing with those issues is having a diverse department and having a culture where people regard each other as people, and there's an openness and an enabling culture of talking about each other, being friends with each other. The contact that I have, for example, with African Americans in the organization here, the personal one-on-one contact, the conversations of trust, that does more than anything else. And that doesn't occur in a non-diverse organization. And the same goes with all sorts of folks, whether it's me talking to, this is my personal interactions or professional interactions with women in our organization, with LGBT folks in our organization. The way to connect with humanity is through relationships. We live here, we spend our waking lives here at the department, and having and fostering a diverse community in the department. And I think this focus I'm thinking of connecting with our community, those are the ways to build human relationships and develop, I think, empathy and the truest understanding what we're going through. So that's I think the way to do it. It's not a class. Not to say there can't be a class, we should be discussing it, but ultimately fostering a diverse organization and taking care of each other and watching for each other and respecting each other is the way to connect.
There's questions in the chat about COVID for Dr. Hernandez. I'm Paul Budenhagen, the other deputy city manager. And Dr. Hernandez, I'll just summarize some of the questions. One asks what the current COVID statistics are for Berkeley and how we're doing. Are we doing well comparatively, and how would we define that in the circumstances? How is COVID disproportionately impacting communities of color? And what are we doing around testing people in board and cares and SROs?
Okay. So I first want to say that there's two pandemics that we're dealing with right now. There's the COVID-19 pandemic that we hope will end, and we have a cure hopefully soon, and prevention efforts with vaccination. The pandemic or the epidemic of racism is one that we will continue to have to work on, and they're intertwined. Before I go into the demographics, I want to address the question about how we doing overall, and I'll look at, first I'll talk about Alameda County, and then a little bit about Berkeley. So first, for Alameda County, right now we're over 4,000 cases of COVID-19 that has been diagnosed in the county, and there are 107 deaths. In the city of Berkeley, we now have 113 cases as of today, and we have 1 death. In terms of how are we doing well? Am I worried? I am worried. I continue to be worried because we don't have those normal tools that we have for the common diseases that we tackle, such as vaccination and reliable medications to help control symptoms and spread. So I will continue to worry until we get those and we have continually contained the disease. However, we have tools that we've now built up and are continuing to build up that are reassuring for me in terms of battling COVID-19, one of which is public health staffing. We still need more staff and some support, but we're getting there and getting people trained with people who are interviewing cases, as well as contact tracers. And those are the individuals that will work with cases and find out who they've been in contact with and identify the contacts and get those individuals tested if they're symptomatic or if they need to be tested, and definitely quarantined. And then speaking about testing, our testing capacity is increasing, which is something that we've been working on for some time. We now have 2 test sites in the community that are open to anyone who wants to be tested, you do not have to be symptomatic. So testing is another tool that goes hand in hand with the public health workforce to help isolate and quarantine individuals that are either infected with COVID-19 or have been exposed. So I'm still worried, but I'm feeling better and reassured because our capacity to control the disease with those set tools are getting better and better as we work through the disease day by day. In terms of demographics, basically what we're seeing in Alameda County and City of Berkeley kind of mirrors what is happening nationally, that we're seeing that people of color are disproportionately impacted by COVID-19, both with infection and with deaths. And that may be due to a number of issues, some of which we talked about already, which is the disproportionate prevalence of certain types of chronic diseases, high blood pressure, diabetes, respiratory problems. Also, other conditions of poverty or multi-generational living conditions where families of multiple generations are living together, and also individuals who are in essential work, do essential work, whether it's service industry or working in restaurants. We're seeing those individuals impacted. When we look specifically at the numbers for Alameda County, I want to tell you the percent cases and then the percent of the population. So this is for Alameda County. We don't have this broken down yet for the City of Berkeley, and that's because our numbers are too small to safely give that information out. So once we're able to do that, we will. But when we look at Alameda County, we see that 47% of the cases of COVID-19 are in the Latinx population, and they only represent 23% of the population. So we know that they're disproportionately being represented in the COVID-19 cases. When we look at Asians, they're 13% of the COVID cases, and they're 29% of the population. So there's less cases in that community. In terms of whites, Caucasians, they represent 11% of the cases, and they are 32% of the community. So again, less disease in Caucasian population. And then for African Americans, they represent 8% of the cases and 10% of the population. So almost 1 for 1. When we look at deaths, we see out of 100 deaths, 29 are Latino, 29 are white, and 23 are African American, and 19 are Asian Americans. So we are seeing that, as I said, the national information reflects what we're seeing locally in our community. And I don't know if there was another question, but I'll stop there and turn it back to you, Paul.
Thank you, Dr. Hernandez. The other part was about testing in our skilled nursing facilities.
Yes, so we have, as I mentioned, 2 test sites, one of which just opened this week, and that one is located on Oregon Street, and again is open to anyone that wants to be tested. That's through appointment only, and that you can access through our website or call if you don't have access to the web. Our original test site, which is on 6th Street, still is operating, and actually next week we're taking it on the road. So we're making it mobile so we can work in specific areas and neighborhoods. We are actually going to be offering testing in a senior apartment community next week, so that we can test individuals that don't have access to testing or don't have the mobility to test. In terms of our skilled nursing facilities, and we are working with the skilled nursing facilities to do testing. We've done baseline testing on the 6 long-term care facilities, which are skilled nursing facilities and a memory care facility. We did discover a total of 4 cases in those 6 facilities, and we're working with the facilities to ensure that there's no more transmission. So we're broadening our testing, and also hoping to reach other communities by working with our partners, so that we can reach individuals where they live, as opposed to asking people to come over to our site. So more to come.
Thank you, Dr. Hernandez.
Thank you, Dr. Hernandez. City Manager, I'm going to turn it over to you. So I'm going to read a question here from the Q&A and read a question that came in via email. They're of a similar theme about leading us through this crisis. With all the programs we need to heal, how can we justify 44% of our budget going to police? Why aren't we seriously facing this straight on? Money and budgets are the core. Am I not correct? The second, a related question. Berkeley needs to lead instead of having people who are more or less emotionally and psychologically disconnected from other humans, who are also basically paid to look for or even conjure up something that is illegal for any given person on the street. Seems like a bad recipe for public safety. We as a society have to somehow address this rift, because even I, as a white person, I feel very apathetic towards the Berkeley Police Department. I mostly consider myself on my own here. City Manager, this question is for suggestions you have to bring.
So Dave, I didn't hear the last part of your question, but it did sound like the writer wanted to ask me specifically to address the budget for our police department and how that budget can be adjusted to address some of the major issues. And I think the term used was defund the police department. I'm not certain because you broke up. There was a lot of narrative there, so I'm going to try and answer that. We have to be thoughtful about how we look at dissecting the police department and looking at how to realign the police department services so that they truly focus on crime. I support that. The police chief supports that. Our organization, our police department, the men and women of this department, they don't want to be social workers. They want to solve crime. And yes, we need to look at how do we do that. One of the ways that you're able to make those types of things happen, and because there's a sense of urgency right now, I think we also have to look at what we all call attrition. We expect and will see a number of police officers retiring and moving on in their lives and starting their next journey in life. And you use attrition as a way to address the changes in budget. That's one way. You also look at how you redeploy your services. Those are operational changes. As a city manager, I can certainly institute, but I can't do those without being thoughtful and having an approach that doesn't put other people, like mental health workers, at risk. And so we have to be careful about how we do it and when we do it. But attrition and changing and realigning from an operational perspective can happen and will happen here in Berkeley. We are going to work on that, but we want everyone at the table. I am not going to go do this in a boardroom by myself. I am going to sit down with people, have a conversation with law enforcement, with Blacks and Browns and white, have a conversation with people so that they understand that we care about their solutions. And so, no, I'm not going to run with scissors and just start cutting and cutting and cutting. I'm going to do thoughtful, deliberate, and intentional operational changes to affect what our community needs from us. So I'm sure there are other questions to that. So if you want to restate that, Dave, you certainly can. But I think I've covered the fact that, you know, this conversation about defund the police, again, that has to be a thoughtful and very intelligent and deliberate process that we go through together. So those are my answers to that question. So if you'd like to expound on the other question, that'd be great. Uh-oh. I'm not sure if I was, did you hear anything I said?
I heard you, Dave.
did.
Okay.
Coming on.
I was, everything was frozen. So it was so frozen. I was like, uh-oh, I don't know if I just delivered that information and no one heard it. So
What you said came through, trust me.
okay, thank you.
It looks like Dave is frozen right now, so I can just ask a follow-up question on that for the city manager, Dee, from the chat, which is, as you talk about police reform, what role do you see the residents of Berkeley having, and how can people in Berkeley help with these issues?
People of Berkeley have got a champion from all corners of Berkeley. It's not just the people. I want the folks that come every day to our council meetings. They have courage, they come in, they provide great information, they give us great feedback. But I need all corners of Berkeley to be at the table with us and helping to make these decisions. The chief and I have talked about how we're planning to set up a series of forums throughout the community to start engaging different sectors within our community to have time with us to talk about how those solutions should be made. What should they look like? Yes, I can go into a room and write on a flip chart, on a whiteboard, and come up with an amazing process. That's where we've gone wrong time and time again in history, is making decisions in isolation. We have got to open up, go to people where they are, and understand how they want to see solutions made. The men and women of the Berkeley Police Department, they also need to be included in these conversations. They have great ideas. They are part of the solution. They are not part of the problem in its entire. Yes, of course, there are issues in every department across the land. But what we have to do is put down the blame and start talking about solutions that make a difference for every corner of Berkeley. And I'm committed to making sure that that happens, along with the chief of police, my leadership team, and all of the men and women in the Berkeley Police Department. We want to see the change. We want this.
Paul, can I add to that? So I guess a way that I see my role in service to the community and in stewardship of the department is to be honest and clear with factual information. I hope it is a strength. I know that it can interfere because I really want to share the real information, whether it's the facts about an issue or the way our people are engaging, the attitudes they have. But I feel like ultimately my responsibility is to relay the most accurate information I can to the city manager, our organizational structure, our electeds, and our community in the hopes that the best, smartest public policy decisions are made. So I just want to say I take that very seriously. And that means that in those conversations, I am open and sharing with all sorts of information. And that conversations about, for example, about response to mental illness and homelessness and the defund sort of approach, which we hear. To that end, I would say that as mental illness and homelessness have crept up in intensity in our community over years, we become the first people who are called, usually because there's a safety issue, often because there's no one else to call. And over time, sort of like sheet by sheet by sheet, has grown into reams, has grown into cases, meaning the amount that we are doing and involved in response to those issues has built gradually to an incredible level. And that's not that we don't have other work that we should and could be doing. Our Community Services Bureau was built to be focused on engagement with the community, to do events like Shop with a Cop, Coffee with a Cop, to host and run things like the community forums that we envision doing. But they have by default become the safety officers, if you will, for responses to encampments and homeless issues. Our people have empathy for people who are in those situations, and our people would rather their time be free to focus on addressing crime. We have major crime in Berkeley. We have thousands of thefts in Berkeley. Our detectives can only do a layer or two of the cases that could be investigated. And by reallocating our resources and potentially shifting our response away from homeless issues, away from mental illness, we sort of would gladly be a participant in realigning how resources are allocated in that. My concern is, of course, that it doesn't mean that then we have nothing to do. There are 200, pre-COVID, there are 200 calls for service a day. Those aren't calls we make up. Those are people calling us for issues. If we can offload some of those issues, if we can reallocate resources to dealing with crime and investigation and the kinds of things we need to make our community safer, then that is what our folks want to do. So I welcome those discussions, and I'm really committed to continuing to give, even though I think it aggravates some in our community, but continue to give kind of full answers. Thank you.
So, and thank you, Chief. I do appreciate those comments. I also want to make sure that I am not remiss in my role as a leader here in the city. Operationally, I'm in charge of all operations of the city of Berkeley. But when it comes to the policy making and the hard work that goes into delivering policy in our city, that is a charge for our council and our mayor. And they are doing an outstanding job trying to figure out how to navigate through this too. So I don't want to miss them in this conversation. I've been trying to keep it around our operations and my delivery as a city manager, but they play an important role in what we do here locally and their reach to our state and national leaders in government. So we need them, and we need them to be a part of the solution and also include us at the table when they are developing and making policy as well. So it is a two-way street, a three-way street in all corners of Berkeley. So I'm very excited as we move forward as a community. We can do this together, all of us, our electeds, our staff, our police, our community. We can do this together. Thank you. Thank you, Dave, for letting me jump in, and Paul for letting me jump in, and Chief, thank you.
No, thank you very much. Chief, this one is for you. So I'm searching through the questions and answers that are coming in, and there are a number of questions for you regarding your comments this past Tuesday at the City Council meeting. I'll read one of them. I was horrified when I saw a video of the chief last night. In response to a question about which tools his department could use as an alternative to tear gas, he said, "We have firearms, we could shoot people." Let me repeat that for you. Our chief of police thinks that only two options for dealing with people, the people of our city, are tear gas and guns. This is stunning, particularly in this moment. The chief has displayed an absolute ignorance of the Black Lives Matter movement. He has shown how little he values human life, and he is telling us this approach to policing is violent and deadly. Another comment here. When you said in the city council meeting Tuesday night that your officers would have to switch to live ammunition since tear gas is now banned, I assume that was your idea of a joke. Do you have a serious answer to this question? How can the community best show respect for BPD and still push for reforms? I think there are many good cops out there and do not want them painted with a broad brush, and we have to think of new ways for officers to interact with the community. Chief, I'd like to turn it over to you to address your comments. You're on mute, sir.
I deeply regret the way I responded to the questions on Tuesday night. A misstep like that is just personally and professionally extremely frustrating. I apologize for that misstep. it does not reflect a cavalier attitude in any way about the challenges of crowd management. It does not reflect in any way a devaluing of life that I have. I was caught up in the moment of trying to lay out what was very important to me, an understanding of the importance of giving our people tools and training to address the issues that inevitably we run into. I can't apologize enough for the words that I said. It created with me, I have a deep sense of regret, and to contribute to create a distraction for our community. I guess I'm speechless. I'm sorry, and I hope that those who I do know in the community trust that that misstep was just that and not a reflection of my values or the values of the police department. So I'm sorry for letting people down with that. And earlier I talked about giving information, and I feel like I was in that mode, responding with essentially very little warning about an effort that in my mind directly affects the ability of our people to be safe in terms of tools. And so that's what was going on. I do regret it, and I will continue to move forward in service, and I hope show anyone who actually takes seriously the idea that I think it's acceptable to fire on unarmed, to shoot protesters. That is, for those who may be listening who actually think that's what I think, please come and talk to me at Coffee with a Cop. Let's talk, because that's not at all me. And I hope many in our community know that. Thank you.
Thank you, Chief. I'll pull another group of questions out of the chat. This one could be for the city manager and or the chief, and it is about police in schools. Here's one of the questions that kind of encapsulates it, which is conversations about removing police from school campuses are happening in cities all around Berkeley. While Berkeley High doesn't have a police presence anywhere near the magnitude of Oakland Unified, there are consistently police officers on campus. What is Berkeley doing about removing police from the Berkeley High School campus? I don't know, Dee, if you want to start with that one.
I think it's important that we remain open and collaborative with our school district. This is a conversation that the superintendent and I have had at least a couple of conversations about the question and the request to start thinking about how does that look? Do we need police officers on campus? I don't know how many that we have currently, so I'll leave that up for the chief to give the exact number. I thought it was one. I think I saw your hand, Chief. I thought it was one officer, but I think the important thing is to talk about where do we need our police and how are they to be a part of our youth's future, and what does that look like? So, and maybe it is to move them off campus and to also share and provide information from a different space. So I'm open, and so is the superintendent of schools. He and I have had some conversations about this. So I'm looking forward to working with the chief and the school district to determine a path forward and how we look at this. I think we're all open to what the new policing on campuses should look like, if there is a police presence at all. Thank you. So Chief, I'll turn it over to you, and if you want to add some comments to that.
So we have one officer, and for years have had one single officer assigned to a campus of 3,500 students. We're way below kind of a standard best practice with that. We've gone to the days where we used to also be able to support our junior high schools. I understand the sentiment, the distrust. I also understand that the SRO and their work is largely misunderstood by people who react purely to the fact that there's a police officer on campus. I asked today for to check files for comments that people have made, and a commendation. And just as an example, this is from a Berkeley High principal. As hard as my staff of administrators and safety officers work to mitigate physical violence situations, intense situations, I want to highlight the incredible value of having someone like Sergeant McGee on hand to help us. He was the SRO, and now it's a newer officer. Sergeant McGee is his supervisor. His knowledge of the physical layout of our campus is valuable, but what I appreciate is his depth of knowledge and experience with our student body. This was highlighted for me personally one day when in the past spring in Civic Center Park, when a relatively new and unfamiliar officer was dealing with this is just a beat officer, not just a beat officer, was dealing with one of our most difficult students, a female who had already had numerous encounters with the police and escalates very quickly. Watching officers who did not know her or the situation try their best to de-escalate, not being able to do so, impressed upon me even more how helpful it is to have Matt with us. He is able to talk to even the most upset student in such a way that de-escalation can occur, enabling us to avoid huge public disruptions whenever possible. I'm aware of financial and budgetary constraints that you face, this was addressed to me, as well as the reality of Matt's promotion. He'd been promoted, so we knew that he was going to be leaving. I feel sure that deciding to continue with the SRO position here must be a difficult one. I want you to know how much I appreciate the continued support. So I share that with you. Fundamentally, I've talked about the importance of connection and how the way you get connection is by being with people and talking with people. The SRO is not at Berkeley High to, his mission is not to make arrests. His mission is not to enforce law. What really happens, and what I would encourage anyone in this conversation, is to sit with Sergeant Matt McGee, with our current SRO, and hear what they do in their day. Because what they do in their day is to serve, to provide resource. They are not in the business of arresting people. And there is crime at Berkeley High School. There have been numerous reports, for example, of sexual assaults. Those are made to us. We need to investigate them. And who better but the SRO, who is moving about essentially that community, who knows staff and has earned their trust and respect, who knows students and has earned their trust and respect. That is, in a way, it's like the penultimate community-involved policing, when one single individual, like Jeff, can have those relationships and operate where he needs to, whether it's investigating crime or resolving problems. To me, it's I do not want to bring that person out. I do not want to divide and segregate our youth from a police officer in the service and example he provides. And furthermore, at Berkeley High School, we have now, I think we're in our third or fourth year of a really, really popular class called Law and Social Justice. That's not pure police focused, but that we've been supporting. And the instructor there, we've come through this journey together of envisioning a 2-year program that helps kids be ready to go to college to get their degree and hopefully come back to us. The motto of that effort and that vision is from Berkeley High School, is from our community for our community, meaning we want kids to engage with social justice, those ideas, what law enforcement does, what it truly can do to serve, so that hopefully they go through their continued education, but want to come back to our community, their community, to serve. So I have an incredibly high regard for our folks and the SRO position. And I would urge that we have a discussion and really understand what happens in those contexts, rather than hastily demand a ripped out extraction. So we want to take a young African-American police officer who's developed trust in the school and trust with faculty and say, no, we don't want you here. That's not community policing. And so I feel very strongly about that, and I'll stop there. Thank you.
Thank you very much, Chief. I'm going to go to a few different questions that have to do with training for you. I'm going to read one question first, and then I'm going to go back to an earlier question that I think kind of breaks down the questions around training. So the broad question, and again, let me read this, and then I'm going to go to an earlier one. It says, Chief Greenwood, I'm hearing you share that connecting and getting to know the community will create empathy between police and the community. Why do you believe that your police have to get to know me in order to treat me fairly? In other words, what kind of training or support do the police receive before they are put on our streets and decide how to handle a situation? So don't respond yet, because I want to go back to one that's sort of multi-part that breaks it down in terms of training. And so I just want to kind of walk through it one by one with you. And I think we'll get through it effectively. Okay, so this is again about training. Do officers have less lethal alternatives when they think that someone is confronting them with lethal force, such as BOLA wraps and the alternative popularized by Ferguson police?
Would you like me to take that one by one, Dave? Sorry.
Yeah, start with that question first, and we'll get to more ones that are germane around training as we go through it.
Okay, just I want to say about BOLA wraps. No, we do not have that. It's we have an open mind to technology. I think but we don't have that right now. So that's the answer to that. If you'd like me to double back to the training question.
Let me go through these questions and you'll see how this all connects to training.
Okay.
I just wanted to get that one question out there and bring in more than one as we go through this. So here's the second question that's going to start. The next ones are going to hit really clearly on training. Is there a training that officers must go through around bias? And if so, what is it? Though I know that there is no training that can eliminate sexism, there are many tests that one can take, such as Harvard's implicit bias test. That's for you, Chief.
So we have for many years used and brought in a woman named Lori Friedel, who is a national expert on training about bias, about implicit bias. It is, I believe, now covered in academy training. And one of the things that we've been looking at recently is that we went through a period with where we sent people to Ms. Friedel's program, trained our people to be trainers. They came back and trained our entire department. So there was a moment in time where everybody was exposed to this implicit bias training. We also brought Friedel and her folks in to conduct community meetings, and many, and I'm sure some on this call, participated in some of those, which is an all-day workshop. We also, and this is related, under Kamala Harris as the Attorney General, who's under her as being the California Attorney General, she supported and created a program called Principal Policing, and that is a training that comes out of experience with work done on bias and on procedural justice, where departments like Stockton and Salinas and others, and this was adopted by the Oakland Police Department. This is a training, an all-day training that embraces the concepts of procedural justice, which I'm going to say now briefly. You asked, and I just want to share. It's the idea that police are only perceived as legitimate actors in our society if people trust what they're doing, and that trust comes from 4 elements, or if the 4 elements of an interaction are in place, then that feeds community trust, and that contributes to people obeying the law and cooperating with police. Those 4 elements that our department has been trained in, because we sent folks who came back and did we sent folks to be trainers. They came back and trained the department in late 2018, early 2019, I believe. Those 4 things for our community are, first, that you give people voice. So when you're responding to a call, listen and give people voice about what's going on. Second, be neutral in your engagement. Don't take sides. Try to figure out what's going on, but do it where you're displaying a neutral approach. Third, treat people with respect. Fourth, be transparent in what you're doing. Explain what's happening. Take that time and be mindful. When those pieces are in place in the interaction people have with police in responding to a call, and I'll use, for example, a domestic violence call, where officers respond, say it's rapidly clear say that one person is injured. We know there's going to be an arrest. Nevertheless, separate people, of course, but give each person voice. Treat them with neutrality at the onset of the interaction. Treat them with respect and hear what they're saying. And then be transparent about what's going on, which means explaining, for example, to the person who's about to be arrested, look, this is the circumstance that I see here. This is the information I have. I'm required by law and policy to make an arrest of you. And I want to explain to you how this process works. And you'll have an opportunity to give your side in the statement, that sort of thing, right? If you treat people like human beings and you treat them with respect, and you give them that time and that space, they tend to cooperate, even if the outcome on the short term is negative for them, like the person's being arrested. Those concepts are about police legitimacy, and those same concepts apply to how I hope we run the department internally. Anyhow, that training that we did in 2019, beginning 2019, also included a refresher on the work around implicit bias. The Harvard, I believe it's the Harvard bias test, although I could be wrong on that. There's a famous online test for that, and pardon me for not remembering it.
Yes,
So,
that's one that's referred to in the question.
We have a long history of engagement with training in that. And now, listen, in the staffing challenge that some of people who are listening have been on this ride with us, where we have this immense drain on staffing and have had to rebuild from a historic low to get to where we are today. That's meant I've hired in 3 years probably 30 officers. What we're looking at now is we have to pivot and make sure that we're getting our CIT training, minimally the 8 hours, continue to offer the 40 hours whenever we can, and that also we refresh on the fair and impartial policing training and on the principal policing type of training. So those are things that we realize we need to go and refresh and make sure that it's either an update for everybody and or catch the people who they're new to the organization and haven't gone through that experience and put them through that experience. And we've been, COVID blasted everything, right? So we've been trying to explore kind of different trainings. I have been trying to explore, for example, the value of mindfulness-based stress reduction and meditation. There is a group called the Compassion Institute that comes out of Stanford University that does a training called Compassionate Heart. And we, in February, mid-February, just before COVID hit, I went with, I think, 10 of our folks to this 3-day training that introduced people to mindfulness-based stress reduction and meditation practice, and talked about the active development of compassion and empathy, generally framed in terms of people that officers interact with and the homeless people sort of on the street, and developing that compassion for them, and that combination of compassion and the calm that comes from a state of mindfulness and of not being reactive to your environment, how that can make us as police officers better servants to the community, and I think take better care of ourselves, that we're in the right place. So I may have given too much of an answer there, but that's what I would have for you right now.
Thank you very much, Chief. Dr. Hernandez, I want to turn to a question for you. We are seeing protesting occurring throughout the community, and understanding that we're living in a shelter in place and that mass gatherings are prohibited. Our community is gathering to express themselves and ask for change. I would like to ask you, what precautions can we take to protest safely?
Yeah, so we are in a difficult time being both in a shelter in place and having these critical issues to deal with in terms of racism and having the need to demonstrate publicly, and I support that. That is our right as Americans, and I feel that this is appropriate to do at this time. And on that note, I still am worried about the gatherings that are occurring. And we know that coming together in groups increases the chance for transmission of COVID-19. So that's one thing. We also know that certain things that we do further increase our risk for getting COVID-19 or transmitting it to others. Singing and shouting, those can project the virus into the environment at a faster rate than just normal speaking does. So those are the things that worry me and come almost hand in hand with demonstrations. So I would urge people not to shout or to sing. Communicate using signs, if you could, as opposed to demonstrating it by singing or chanting. Wearing face coverings do work. That does work. It is science-based and supports our ability to actually get out more and more and be able to congregate in these manners. The other thing that I worry about is having the disease and not knowing it, and then transmitting it to others that are either in your family or in your workplace if you're back at work. So I urge people to get tested. And what my advice would be, about 7 to 10 days after you've gone to a demonstration or you've come home, that you get tested, whether you're symptomatic or not, because we do know that COVID-19 also infects people without having people not having symptoms, so it's asymptomatic. So that's what I would say is wear your face coverings. If you can socially distance at that 6 feet, please try to. And if you do go to the gatherings, use signage as opposed to singing or shouting, and then get tested.
Dr. Hernandez, can you remind people how they can get tested in Berkeley, where they should go, what they should do?
Sure, yes. So we have 2 test sites specifically in Berkeley. Both of them are available for anyone who wants to get tested. You would go on the website to see how you would register for testing. And there's also a number if you don't have access to the web, and I don't have that number on me right now, but I can get that by the end of tonight. So you could call the number and get scheduled for a test, or you could call 981-5380, and they can also direct you to the test site login, or they can help you get scheduled. So those are the 2 sites in Berkeley. You can go to your medical provider and ask to get tests. More and more medical providers are getting availability to testing kits and swabs. There are also other test sites throughout Alameda County and Contra Costa County. So if you happen to be more located closer to those test sites, there's a map on our website so you know where to go. That's also available, and often those are available and open to anyone regardless of where you live, and they're free of charge.
Thank you, Dr. Hernandez. We've had a few people asking what the stats are on this town hall. I'll just say that we've had about an average of 400 people watching from wherever they're watching over the course of the night. Thank you all for being here and tuning into this. Deputy City Manager White and I have been scanning through. There's currently 253 questions in the chat. So we're going through and trying to find themes and synthesizing questions and then asking them of our panelists here. So here, just a little fact, just some background on this. This is a specific question, and I'll address it to our city manager, D. Williams-Ridley, and it is, what will the city do to provide extensive social support based on unarmed urgent responders so that the public will not be limited to the sole choice of contacting police officers that are armed?
Thank you, Paul. Can you repeat the question? I lost you there for a moment.
Sure. The question is, what will the city do to provide extensive social-based support instead of for unarmed urgent responses so that the public isn't limited to a police response, essentially?
Right, and I think that goes back to the question of how we look at our policing and deployment and this whole conversation around defunding the police. And so when you talk about social-based support, I'm thinking about the mental health support, our homeless support, working directly with our community and youth and having neighborhood groupings and meetings. So I think that kind of support is available currently in our city, but it's not enough. So we have both mental health, public health support. We have a neighborhood services team. We have a non-uniform, non-police code enforcement team that these folks are out there working every day with our community. But this needs to be a focused delivery, a model that's very focused on what our community is sharing that they need and what we can provide as government. So I'm very interested in thinking further and talking more with people about what does that look like. I think our council, our mayor, and others are very interested in engaging with our community to also push that question and find out how can this look and how can this work for our community. So it's a big question, but I think we know the direction to go in. I think it is putting greater resources toward our mental health, our public health workers, and also providing them with the type of healthy and safe environment for them to perform. So we've got to stay focused on that as well. It can't be just throw them out there and tell them to go do it, right? And we've got to really think through how this happens for our community. So, but there is a true sense of urgency behind this. This cannot be a long, engaged, burden process. It has to be quick and intentional, but we can figure that out, and I think it will look incredibly different if we're and when we are successful. Thank you.
Paul, may I add something, please? Paul?
Sure, please do.
Just super briefly, our people, for example, in Community Services Bureau who go and support other city staff in response to encampments and camping issues, and our officers who go to support our colleagues in mental health, the mobile crisis team, they often go because of safety. And I think a big examination is going to be how do we either, and that sense of safety is not the officers saying, hey, it's unsafe. It's the other folks who work for the city feeling unsafe. They are in a position of some risk. And I think the conversation just needs to, for those who are talking about this issue, need to, I hope we will broadly embrace and include the other employees with the city of Berkeley, the folks who are doing that work. We're fine in a sense, not going, and just in a broad sense, but we go because we get and we are told we're providing a sense of safety. And in some cases, we are the ones who are kind of who have the law behind a request to do something. I was talking about earlier with one of my professional staff, about folks in public works. And she was pointing out that it may be off my radar, but a lot of times the folks in public works or parks also have developed relationships with people, for example, in encampments, and there might be space to do more work without police presence, so long as they believe they're okay. They may know people, they have routines with people, they interact regularly with certain people, and will come and say, hey, we're going to clean this area, so we need you to move from here to here while we do that, and that's not a problem. And I'm looking forward to exploring how we can maybe adjust to a lesser need for police to be there while respecting and being connected with our colleagues in mental health about their need for their own personal safety. I take that very seriously as well. I just want to say that.
Thank you, Chief.
So a couple of questions here, but the one I want to address was directed to myself. So the question was, how are we going through these questions? I will say there are more questions that we can get to in this short time. So both Paul and I have done our best to read through questions that have come in, but as Paul had mentioned, we've received more than 200 comments or questions just in the short time that we've been with you. So I appreciate and acknowledge and name the frustration that many of you are experiencing in terms of getting all these out. And unfortunately, they're just coming in faster than we can handle it in this electronic format. What I would like to do now is really turn it over to conclude. I know that folks would like us to keep going, but it is getting late. And as our city manager has mentioned, there's going to be more of this to come. And, you know, we obviously hope to be in formats where we can be face-to-face and speak with folks directly. So I would like to turn it over now to our featured guests. First, we'll start with Dr. Hernandez, then we'll go to the chief, and then our city manager for some concluding remarks. So Dr. Hernandez, you first.
Great, I'm glad I got back on. My internet was a little faulty, so I apologize. Again, I want to thank the city manager for hosting this conversation this evening. It's definitely a critical conversation. It is the beginning, not the end of these conversations. We in public health have thought about these issues and have been working on these issues in the work that we do in the division and with the health officer unit, but there's more that needs to happen. What we know is that when we look at health disparities and the issues that we see our communities dealing with day after day, it's not race that causes these issues in health disparities, it's racism. And we know that that's how we have to kind of shift our mindsets when we address these issues and impacts of health outcomes on communities of color. So I'm again happy and honored to be in this conversation and joining with the community in this work as we move forward.
Thank you, Chief.
Mm-hmm.
So I really appreciate this opportunity in this forum. I feel like I could go on all night. I'm always interested in talking to people about these issues, even in quote unquote normal times, but now more than ever. I just want to say that Black Lives Matter is in law enforcement is perceived as a kind of a third rail topic. There's a ton of reactivity based on a whole bunch of things, and share that my understanding and where I'm at and where I think many in our organization are at is that Black Lives Matter. I understand that the movement has been impacted by spin, by politics, that when a cop says Black Lives Matter or thinks of Black Lives Matter, it may be this spectrum that it's, and this is I wholly disagree with this, but it's cast as some sort of terrorist organization. And on the other side of the spectrum to me is that it's cast as what I believe it is. Black Lives Matter is a movement to call attention to just that. And I saw a saying that said, whose narrative informed my perspective. And it's that Black Lives Matter, and the movement didn't say only Black Lives Matter. It said the idea of only Black Lives Matter is something that was spun by others, by the media, by misunderstanding, and the reactivity of where we're at. In truth, I think the idea is we're calling attention to the fact that Black Lives Matter. They know, the movement knows that all lives matter, but Black lives have supported our lives in America through hundreds of years of slave labor that built our country's economy. And the importance of this is, it was so much conveyed to me by a former Berkeley officer who gave a talk, a sermon at church. I really received, our house is burning. Like, it's taken all this time to finally gather the attention of people, that people are undergoing this pain and it's wrong. So when I affirm that my perspective, and I hope in a broader and broader group in law enforcement and the profession, that in our perspective, the saying Black Lives Matter simply says that, not to the exclusion of other lives matter, but to call attention to the historical realities of what Black folks, Black people, African Americans have been through in our country's history, that needs to get attended to, and we need to work out a way to reconcile, to move forward in a positive, and I think in a direction that we maybe collectively have not yet found. I just want to share that. When I hear Black Lives Matter, as I say Black Lives Matter, that's where I'm coming from, in support of the movement in that spirit. I really appreciate that we have so many people who have taken the time to hear us, and I look forward to a future of more dialogue and honesty. I hope the setting aside of blame and shame. I hope that we have the resiliency to hear each other out and build productive ways forward. Thank you.
Thank you, Chief. City Manager, I'd like to turn it over to you for the final remark.
So thank you so much. Dave, to my Deputy City Manager.
I'd like to turn it over to you for final remark.
Okay. Can you hear me now?
Yes.
Okay. So to my two deputies, so Dave White and Paul Budenhagen, I want to thank you both for moderating this evening's conversation and to reconnect with our community on race and health and community policing. This is not the last time that we'd like the opportunity to sit with our Berkeley community. I want to thank our health officer for her amazing leadership throughout this pandemic. It has been a journey and a tall, hard task for her and her team, and I thank them for their work. To our staff and our Berkeley Police Department and the men and women that serve our community. This is hard. It is a tough journey for us all, but we can work together to find solutions for our community that mean and matter something to them. And that should mean and matter something to all of us. We know that our nation and our city and our residents and community is in pain. There has been tremendous amount of pain that we've all endured. Some of us our whole lives. Some of us, it's becoming a reality to them today, yesterday, last week. But moving forward, there is light. We can do something wonderful and build something progressive that matters to people in moving forward. The great thing is that we have a wonderful platform, a wonderful community that's always willing to engage. And you can see that by the number of people that joined in on this call this evening. And I am profoundly grateful for your time that you shared listening to us and being a part of sharing your concerns and questions with this team. We have a long way to go. We have obstacles to overcome. We have challenges that we will continue to be faced with. But as a community, as an organization, our goal is to come together and put forth something really positive that we all believe works and reduces the racism that exists in our communities. I often have given lectures on race and equity and inclusion. And one of the things that I've been able to share with folks is that, yes, we can have all the policies and laws and all the things that on paper look great and that they hold people accountable, metrics and data. But what has to change is what people feel and hear. We have to change the heart and mindset of how we care about each other and how we think about each other. It is critical and necessary and fundamentally at the essence of how we advance and move the needle on racism. So I am committed to being a part of the change that needs to happen for our community, within our organization, within our city workforce. And I applaud the leaders on this line today, and I applaud the community for being here today and engaging and even wanting to sit and listen to all of this. So thank you. Thank you so much. I look forward to another engagement with all of you. I can't wait until we can hold a public forum where we are in person and we are talking together with one another. But for now, we have to talk with each other virtually, and I'm glad that we're able to do so. So I thank everyone for their time this evening, and I applaud everyone for their efforts as we move forward as a city. Thank you.
Thank you all. We're now going to conclude the town hall. Have a good night.
Good night.